It is estimated that 1 in 4 young people will experience a mental health issue over the course of a year. At a particularly important time of their lives, university students, like me, a Coventry University Year 2 student, can be particularly prone to a mental health issue. Around 46% of male and 64% of female young people are currently diagnosed with a mental health issue. Coventry University hosted a mental health and wellbeing awareness day to highlight the issues that mental health can cause. I met Alex Connell, who had a very interesting story to tell me.
Yes, definitely. I've recently been diagnosed with a mental health disorder myself, and it's something that I've struggled with for about 6 or 7 years, and I'm very aware of other people suffering as well. So it's a big topic that people seem to ignore. It's called cyclothymia, which is, as Stephen Fry called it, bipolar light. So it's bipolar disorder. It's not full-blown bipolar, but it's a milder version. It's more manageable, but it's still hell sometimes. So, yeah, that.
I know from experience that studying at university while coping with a mental health issue is hard. The stress that comes with a high workload and the demand for high grades, mixed with issues such as homesickness and isolation, can leave students feeling very low. Anxiety is an issue that affects many people worldwide. Behind me is a particularly busy area of Coventry city centre. Recently, the sheer number of people using this slope caused me to have a mild yet terrifying anxiety attack, which left me very shaken. Even though this was quite a scary experience for me, there are many, much more serious instances of anxiety. To find out more, I've come to Coventry and Warwickshire Mind to speak to volunteer Rachel Jackson.
The symptoms of anxiety are restlessness, a sense of dread, feeling constantly on the edge, but also there's a difficulty in concentrating, an irritational feel.
Okay, and what can they sort of pose, particularly with students who may have quite a high, stressful course to go on? What difficulties can anxiety pose with students in particular?
Especially with students, you've got a lot of homesickness, and that can cause a lot of anxiety pressures, being away from home, because you've got that loss of support mechanism that you built around your home. But also when you come to uni, there might be more anxiety because you want to feel that, and you want to feel that build up. Okay.
And often depression and anxiety can sometimes go hand in hand. How can that in itself affect students?
Well, anxiety and depression work together because they can create a sense of isolation. So students can feel more alone, more pressure to be with someone, but then obviously if you feel like there's a gaping hole, then they'll feel like they're more on their own and not supported enough.
So it's feeling alone,
yes.
The sort of feeling that, you know, you've got no one around you to help.
Yeah, definitely.
What sort of support are there, or is there rather, for students? 'Cause there's obviously Mind, there's probably services at their university, but in general, what are there for students if they feel depressed?
I think with depression and anxiety, I think some of the things that you can go through yourself. So for instance, especially during exam periods and coursework periods, you can go through gentle relaxation. So tensing your muscles in your palms and gently opening them again, tensing and opening them. So just gentle muscle relaxation poses, but also like candles, chocolate, reading a book, and plenty of sleep, fresh fish, fresh veg, all what we've been told to do from an early age can help anxiety and depression, especially during periods of pressure, because it just releases a lot of tension.
But I actually did start self-harming towards around this time last year, and I sort of felt like I was pushing away my friends, and still do to this day. What advice can you give to the people who are trying to support those with depression and anxiety and other mental health issues? What will be a message to them?
To the people who support them, I think the best advice I can personally offer as a volunteer in the drop-in centre as well is just to listen, to be there, to give them, like, you can do this, you can get through it, and just being there. Like, I am there for you. Like, it doesn't matter if you're bad at this point or you're good, and you have your highs and your lows, but you're there no matter what happens, or the down days and the low days, because that's what the service mind provides. If we're not just here, you know, when you have your great moments, we're there to happy and congratulate you for them, but we're there for the fall as well.
Okay. And if I could just wrap up really quick, what more, in your opinion, do you think could be done to assist students, whether it be at university or in general? What more do you think could be done?
I think more awareness is definitely needed of mind, but also the services around the university. There probably needs, if we're talking just a university basis, I don't know what caters within Coventry University, but I'm sure they have a lot, but it's just making students aware that there is that contact and there is steps in place that people can turn to when they suffer with mental health issues. I think if people turn around and judge you on a mental health issue, then it's disgusting and it shouldn't be accepted by anybody, and you should go to someone else higher up and say, look, this is happening.
Studying at university is hard enough, but add in the pressures of studying whilst having a mental disorder and it's even harder. I've been so taken with Alex Connell's story, I simply have to meet her again.
It can be really, really difficult. Some days just seem absolutely pointless. Some days I just literally can't get out of bed. The university's been really supportive with that. They know that I've had some difficulties, and my record at lectures, the attendance isn't particularly good, but they've been very understanding and they know that I keep up with things as much as I can. I do have a tendency to self-harm during depressive phases. I'd say the recent one has been the worst. I put myself in hospital overnight, which was really scary. But yeah, they're the worst bit, I'd say. The depressive phases are the ones that scare me. And if I can feel one coming up, then I get quite anxious and find it a bit difficult to concentrate on whatever's going on around me.
I know you mentioned about the self-harm and the being in hospital. If you don't mind me asking, what triggered that particular one?
Alcohol, to be honest. A friend of mine and I, we had half a bottle of wine each, watched a film, and I wasn't feeling particularly good. I'm on antidepressants and lithium, and I'm not supposed to drink when I'm not feeling good. And I guess I wasn't honest with myself. I didn't turn around to myself and say, actually, you're not really feeling too good. And the alcohol also affects me more than it would usually do if I wasn't on medication. So I was quite tipsy and just had a go at myself.
On the flip side of that, onto the sort of the happier side of it, can you just describe your sort of feelings when you go through that? Do you feel like you're ready to take on the world, for instance?
That's a very good way of describing it. You feel absolutely invincible, and every tiny little thing just makes you smile. Like you're walking down the street and you're spotting little different things. Like, I don't know, it's a bit American Beauty, but when there's a plastic bag going down the street, it's really pretty. You're hyper aware, and these little things just kind of spark you up and you feel great. And alcohol doesn't seem to, I can drink more. I don't drink all the time, that makes me sound like an alcoholic, but when I go out I can have a really, really good time with my friends, and I'm talking with everyone and really friendly and sociable. And I love it, absolutely love it, but it's too extreme, it's too much. If I was like that all the time, I wouldn't have any friends. They'd get fed up with me, and I'd be exhausted completely. I'd just run myself into the ground. So even as amazing as they are, they're just too much.
I know you mentioned earlier about your lectures and the university being quite supportive of that. If you would speak to someone who was going through something similar to you and they were at university, school, college, what would be your advice to them? Would you say try and keep going? What would be your advice to them?
Go to the doctors. If you feel like you have something wrong with you, the doctors do take you seriously. That was one thing that I was a bit worried about when I first went, and I was like, I think I might have some sort of bipolar disorder, because looking back at the last few years, that's not normal. But the doctor was really, really helpful with that, and he put me on antidepressants and he referred me through the system, and he actually specifically said that he wanted me to go to a psychiatrist rather than just being, I don't know, fobbed off with a counsellor. Counselling's fine for some people, but it's not what I personally needed. If your school, organisation, college, uni, whatever's got any sort of counselling service available to students, just go. You're not going to lose anything by it. They usually send you a form and you go through sort of in detail what your problems are, and they read through that before you go to your consultation, and they know what they're talking about. They're trained professionals. They're not just like primary school counsellors or anything like that. They're really good and really helpful and really knowledgeable as well. Definitely don't be ashamed of it. Nothing to be ashamed of. It just makes life a little bit harder, and you're actually stronger for coping with it. And just go and see someone.
The negative stigma surrounding mental health still exists. This stigma makes the already difficult task of coping even harder. Just one ignorant comment can push a person back down again. But the question is, what could be done to combat it? First and foremost, campaigns to raise awareness need to keep getting the support from the public. But the most important thing is to give people the chance to say how they are feeling without the fear of being discriminated against. Education is vitally important.
Because we should break this stigma, and people should voice out. If you feel that someone's done wrong to you, it should be voiced out.
And that's what I suppose people like Mind in the Time to Talk hashtag that's going around.
Yes.
You know, I suppose they're the way that the media can help.
Yeah, definitely. We are going to change it. It will just take time, but with the support of people within the media and also with the general support of the public, we can change this. This can be changed. It's not rooted. We can change this, so we just need to have it so it does change.
Finally, I would just like to give a word of advice to anyone affected by mental health. Firstly, and this might sound like a cliche, but your family and your friends are always there for you. Even if you can't really talk to them, get in touch with an organisation like Mind. And to those unsung heroes who pick us up when we fall, thank you. You quite possibly don't know how important you are to that person. The advice is the same. There is always help for when you can't cope as well. So, let's talk it out together. Thanks for watching.